this is really, I think, a tipping point in the history of Einstein in terms of the generous gift that Dr. Gottesman has given. We're both Rye inhabitants. We both live in the same town. I see you sometimes in town. And the fact that, sometimes from things that seem negative, positive things come out. So the fact that we're on probation from the LCME, if it hadn't been for that, I don't think so many of these initiatives might have begun. So I think it's a very exciting time. A new dean and full of energy, like the ever-ready bunny, full of energy, and all these new deans. I'm very excited about the future of this institution, and it just encourages, promotes my pride in this institution. Thank you.
Very good. Thank you again. I am so proud and fortunate that you and Judy have accepted to come here today. And since the next, I guess, 25 or 30 minutes that we have left are dedicated to your career as a neurosurgeon, I thought we would begin by simply asking you to give us a little insight as to what it's meant from 1973 or 74 when you first came here. I know that it probably would take another 2 or 3 hours of the dean's time also, but we'll try to be brief and make sure that people who don't know you really recognize the impact that your life at Einstein has had. So what has it meant from 1973-74 to you?
In the blink of an eye. Our daughter was looking for a school for our granddaughter 3 years ago. She was looking for first grade. And Dana said, in New York, there are all these fancy schools, et cetera. And she said, but what I'm looking for is a school where I and my daughter, our granddaughter, will feel at home. And I gave a short talk right before the luncheon, before graduation, for those of us who were honored. And I realized that Einstein was home. Now, why was it home? And I'm not a psychoanalyst, although sometimes I think I need one, that as the child of Holocaust survivors who my parents had to leave Europe, and then I was born in China because China had open immigration and 20,000 Jews settled in China and then had to leave China because of the Cultural Revolution, and then ended up in Canada and eventually ended up here in the United States. I always, on some level, and it's now more or less a common theme, both in theater and literature, about where is your home? When 20% of the world are migrants, there's always this question, where's your home? And I realized that for me, I was always looking for home. And when I got here, I really felt at home. So what did that mean to me? It meant that this is the days before, internet and things. So every night after classes, a group of us would get together in the dorm. One of us was assigned to take notes. We all took notes, but one of us took notes, hand wrote them or typed them, and then one of the offices allowed us to use the Xerox machine, which was about as big as, it was enormous, and then we'd all get together at the end of the day and review the notes. And it was a collaborative effect. The dean talked about the great collaboration that's always been a hallmark of this institution. And I felt supported. We were all in this together. If one of us didn't do well, none of us did well. And I just felt that I always felt at home here. And then when I did my Ph.D., which means that I'm older than most people in the class of 74, there was tremendous collaboration. I decided to work with a man named Bob Terry, who at the time was head of the pathology department, but was a world-recognized neuropathologist. He was the first to understand that in 50 years or in 40 years, Alzheimer's is going to be a major, major issue. And the other focuses, and the Kennedy Center just began. And I had the opportunity at lunch every day, we would sit together. Bob Terry, who was the chairman, and Sei Hirano, you probably don't know these names, who discovered the Hirano bodies and the Lewy bodies, first described them in Alzheimer's. There's some people shaking their heads. Bob Ledeen, and the other emphasis, like my own, was on lysosomal storage diseases. So we had Alex Novikov, who was nominated for a Nobel Prize. We had Bob Ledeen, who identified the fact that there was a disease of sphingolipidosis. We had Spencer, who then became chairman of neurology in New Jersey. I mean, every day, we had this collaboration. I sat as a student with all these amazing professors and teachers who were there to support me, to encourage me, and sometimes to point out that I wasn't as smart as I thought I was. I remember walking once in, I worked with Murray Bornstein, who was an MS, well-known MS investigator of blessed memory, who was able to reproduce demyelinating disease in tissue culture. And I worked in his lab, and I developed a tissue culture model for Tay-Sachs disease, and I was able to develop these inclusion bodies that you see in Tay-Sachs disease. And I went into Bob Terry's office, so excited, and he said to me, well, did you measure the periodicity of the lamina? How does it compare to what we see in the real disease? And I hadn't, and I felt like such an idiot. And I said, I'm never going to let that happen again. And so, yes, it was such a supportive environment, but also critical thinking. My Talmudic background seemed to come in every once in a while. So, at the time of graduation, I was about to enter this is to answer your long-winded answer to your question. So at the time of graduation, I said, well, what specialty shall I go into? And Terry said, you can combine academics with research if you go into neuropathology. So I did a rotation, actually, in neuropathology, Jacobi. And someone there said, if you're going to be a great neuropathologist, you should do a rotation in neurology. So I did a rotation in neurology with Bob Katzman, who many of you also know, also blessed memory. And Bob said, in order to become a great neurologist, you should do a rotation in neurosurgery. I had the great honor in neurosurgery of one of my mentors was Leo Davidoff. For those of you who don't know, Leo Davidoff was one of Cushing's residents, the father of neurosurgery. And is also his only Jewish resident. He was not very kind to Jewish students. And Leo said to, and I was so taken with Leo, he was also the child of immigrants who came to the Boston area at the age of 16 or 17. He graduated at the top of his class, went to Harvard. After 2 years of Harvard, went to Harvard Medical School. And not that I'm comparing myself in any way, but he was a model for what is possible for a son of immigrants or a daughter of immigrants in this country. So then I decided that I would take David Roth's advice and went into neurosurgery. I had the good fortune of coming from a school like Einstein, where I got a general internship and residency in surgery at NYU, which was at the time was the top surgery program in the country, and then residency at the Neurological Institute, which at the time and still is one of the top 2 neurosurgery programs in the country. But I've always been surrounded by Einstein graduates, always. After 2 years in academics, I decided, for a variety of reasons, that I wanted to go into private practice. And 2 of the residents here at Einstein hired me in Westchester. And I've built, at the time, the largest neurosurgical practice in the country. And surrounded in Westchester. I wouldn't be surprised if Westchester has the largest number of Einstein graduates per capita of any county in the United States. So a lot of the referring doctors, a lot of the obstetricians, in every specialty were Einstein graduates. And when I was president of the the Alumni Association, we'd have, Judy and I would host meetings at our home in the backyard. I remember one where we feted Dom Purpura, who was dean here, and who then was dean at Stanford, but didn't like Stanford, came back because he also thought it was home. I remember, just as an aside, Dom, we would invite him to our homes, and we would play Monopoly or study together. It was a congenial place. So I ended up in neurosurgery because of Einstein, as a result of the people I met here, and had the good fortune of practicing in an area surrounded by my internist, who graduated at the top of his class at Einstein, is an Einstein graduate. So I'm very blessed. This institution has blessed me with good fortune. Yeah.
Congratulations to you. And I certainly appreciate you walked back memory lane. I am fairly sure that for some of our contemporaries, the name like Cushing's and other things that we were rather familiar with at one point or another. For the younger generations, they probably will have to read about it in the textbook, but hearing from you directly, who's known those giants, is certainly inspirational.
You get old enough. And then the giants are all forgotten.
Yeah. So it's been a certainly nice journey that you have had, and I was wondering if you would want to share with us today what it is that's keeping you motivated and what's keeping you busy these days.
So I had the good fortune also of working with other surgeons, neurosurgeons, and orthopedic surgeons in my group, and in that process, we developed about 30 patents. Most relate to surgical instruments. Some of these instruments are used all over the world. That still occupies a lot of my time in terms of furthering equipment. Our emphasis was how to make an operating room safer. And so we developed all kinds of equipment that we think makes the operating room safer. A drill that, if it gets near a nerve, will automatically stop and retract. Electrified screws in an orthopedic procedure. Neuromonitoring. Our group had a big company, 200 some odd people, that did neuromonitoring across the country and also in Europe. So we keep thinking. I keep thinking. My colleagues keep thinking about the things that make surgery safer, how to make a safe operating room. We were the first to actually do, now it's standard, to do stop before surgery, to do what we call a timeout. We actually at one point partnered with Sully, the fellow who landed the plane in the river, in the Hudson River, because he felt that a lot of the things that pilots do can be used in the operating room, like a timeout. And so those are the things that occupy my time. I like to read. I've been studying. So, you know, retirement gives you time. You think it gives you time, and a lot of folks here are retired, and then you realize you have no time. How did I do this before? So, and enjoying my community, enjoying my family, my wife, enjoying my grandchildren, and trying to lead a life that has value, has worth, both for myself and for my community.
Very good. Thank you very much. What you've just heard is a Jack Stern Ph.D. talking. And in spite of the fact that he was reluctant for me not to present this, in the year 2014-2015, the clinician Jack Stern embarked upon a mission, literally, with a tiny little volume entitled Ending Back Pain. Do you remember those days?
So when I started the neurosurgery group in Westchester, the three of us who started the group before it became so enormous did everything. And I used to carry a craniotomy set in the back of my car. Because I'd be in New Rochelle Hospital, and I'd get called up to Northern Westchester Hospital, then White Plains Hospital. We covered the entire Westchester, and even a little bit further. But as the group grew, people were trained as subspecialists. So we hired a neurosurgeon that did a fellowship in aneurysms. So I wasn't going to do aneurysms. Well, it wouldn't be fair. They were neurosurgeons who did a fellowship in brain tumors, and a fellowship in pain, a fellowship in... So after hiring all these people, I realized there's only one thing left for me to do, which I was never really interested in, and that was back pain, which is an epidemic in the world. Epidemic. Billions of dollars are spent every year treating back pain. There's probably not a person here after 65 that doesn't wake up in the morning with some degree of back pain. I decided when my mother-in-law, who I loved very much, she was dying, and I had all this. I used to sit at her bedside, and I said, I can use, and then she'd, wake up and didn't wake up. I could use this time more productively, so I took a big yellow legal pad, and I said, I'm going to write this book on what I know. And so I hand wrote it, and then I would go to the office where, like my patient notes, I transcribe something, and then it would go to India and come back in the morning. Still do that, and so I dictated the book, and lo and behold, there was tremendous interest. The book has sold thousands of copies, still on Amazon, and what to me made the book different is that when it comes to back pain, but also so many ailments, there are all these unproven treatments. Unproven treatments. Like, even you watch TV, Prevagen. There's no evidence, that Prevagen works. So I decided that I was going to write this book, but every chapter on every disease, I would quote the literature. Now, of course, that was 10 years ago. The literature you'd have to revise the entire book, which I'm too old to do. So the book was different from Manishtana. What's the difference between doing this book and all other books? This book was based on the science that was available at the time. And, it was reviewed in the Times and other publications. And at the time, I think it was very valuable. I'm not sure how valuable it is today. So.
Oh, I'm sure it is. Yeah. For those of you who are above 50, I highly recommend that you get your copy. And in spite of his modesty, there are innumerable advice and recommendation that you will find in there that will be really practical, not only to you, to your loved one, who also are almost guaranteed to suffer some aspect of spinal discomfort or back pain or shoulder pain. So we certainly are grateful to you for having taken the time to do so. But to conclude, Jack.
I just want to brag a minute and say that I used the money from the sale of the book to fund a room in the library, the Albert Einstein room, who was my great mentor, the great pathologist Alfred Angrist. So that gave me great pleasure. He was gone at that time, and it was great pleasure that I could use some learning that I developed here to encourage future learning in that room. So
that's very nice. So maybe we should ask. We should ask our dean whether or not the Jack Stern room is still preserved in the renovation that took place in the past year. That was really fantastic. So that's for the older folks. For the younger generation of bright, absolutely phenomenal medical students who begin here at Einstein as first-year student, are there some bits of advice, not only you would like to offer them in terms of how to really navigate all the tumultuous storms that they are likely to encounter, but as a neurosurgeon, whether you think this is really something that more and more of Einstein graduates should consider as part of their legacy.
I asked Min, by the way, thank you, Min, to see how many Einstein graduates there are who went into neurosurgery. I know several, actually. The nice thing about neurosurgeon, I think a lot of the surgical subspecialties is that you don't make a living by seeing patients. You make a living by operating. So what does that mean? That means that I had as much time with my patients as I wanted. I knew their names. I knew what they did for a living. I knew what their grandchildren did. And it was a luxury. It was a luxury. And I never did more than X number of cases a week, but the rest of the time I could get to know. So getting to know your patient, I mean, I'm talking to the choir. It's almost ridiculous what I'm doing. But in a specialty like neurosurgery, getting to know my patients, really, it was two things. One, it was a tremendous burden on me because I really knew the person who I'm operating. I remember this woman who had 5 kids, and I was operating on her aneurysm. And I said, "Oh shit, please let this go well." Yeah. And actually, for years, I would take, whether they realized it or not, I would take a patient's hand as they were going to sleep. Some knew what I was doing, and daven and say a few words. Yeah. Because I felt, and I think that's a lesson for all of us. As good a job as you do, I could do a perfect surgery and have a crappy result, and it's not all in our hands. And so a lot of it's that combination, particularly in my field, of the arrogance of thinking that you can go into someone's brain or spine, and also at the same time have the humility of knowing that you're just maybe a very skilled tool, but you're just a skilled tool. And don't think of yourself as godlike. Yep. Yeah.
Very good. Well, thanks again very much. On behalf of my class of 1974, we want to express our sincere and deep gratitude to you and to Judy for having taken the time to join us today. I got little signals that we have to move on because we have a heavy agenda. So we certainly appreciate your attention. And once again, Jack, congratulations and lots of luck to you.
Thank you so much,
Fantastic. Thank you.